You can't tell just based on looking at someone that they do or don't have schizophrenia. People who struggle with schizophrenia and they're in treatment, they can look like you or me, holding a job, having a family. And so it's really important to make sure that we share that information so that people, if they do happen to have symptoms or get diagnosed, can be hopeful about the fact that this is not a terminal illness. This is something that is treatable and that people do live happy, fulfilled, productive lives. Schizophrenia is a chronic illness that typically is described as someone having positive symptoms, which look like hallucinations, or you could be paranoid, or we call those kind of paranoid ideations where you're thinking that someone is out to get you or trying to hurt you. They also tend to have delusions, which are just false fixed beliefs. Hallucination and delusions are both, in the essence, a break with reality. So there's the loss of that ability to really fact check and really come back to reality. Hallucinations are things that people tend to often see outwardly, whereas delusions are beliefs that people hold, and it's hard to maybe know unless you are maybe challenging them or talking to them about their beliefs. Sometimes those can be kind of a little bit more hidden. The other domain where we see symptoms for someone who has schizophrenia could be in negative symptoms, where there is just a negative affect, there's a decreased motivation, decreased energy and effort to kind of just carry out activities of daily living. And then there's cognitive symptoms, which look like inability to focus and pay attention. They can often have disorganization in thoughts as well as disorganization in behavior. This is a chronic illness that requires ongoing and consistent treatment. And with consistent treatment, there are great outcomes. People return to school, they return to work, they have families, they're productive members of society, and they live healthy, happy, productive lives.